Okay, well, here we are once again, Paddy Expat Club. It's a Tuesday, Hotel Barracuda. It's Ron Carter here again, and as always, it's my privilege to interview our speaker today, Dr. Sirirat. Have I pronounced that correctly? Sirirat, is that right?
Yeah,
Nakdang.
Sirirat.
Sirirat.
Yeah,
Nakdang.
yeah,
Okay,
yeah,
well, look,
yeah.
thank you. Welcome for coming.
Nice to meet you.
Please say hello to everybody.
Hello everyone.
Very easy, okay. Look, you were talking about man up to prostate health, which is something that's important to everybody here. And so, look, just explain, how common is this?
With this condition is the very common.
Is
It
it?
can happen in every male with the age over than 60 or more than 55.
Okay.
It will happen to any of us, even me.
No. And that's why it was good, because as everybody knows, the Expat Club is mainly mature men, let me say, not old.
Mature,
okay?
yeah.
And,
Not that old.
Okay, so anyway, and then you start off with benign prostatic. Have I pronounced that correctly?
Okay.
Yeah, what is that?
This condition called the benign prostatic
Yes.
hyperplasia.
That was it. I couldn't get the last word. I couldn't remember the last word.
Yeah, the hyperplasia is the Latin or the terminology from the bigger.
Okay.
From the, as a simple way,
Yeah.
we will translate it in the easy way. The benign is not the cancer.
Yeah, that's it. Yeah, okay, that's important to know.
Yeah, not the cancer of the prostate are getting large.
Okay.
Yeah, in the easily way to translate it is the not the cancer, but the prostate are getting bigger.
Yes, and that causes some problems, okay? And then you spoke about treatment goals. I mean, obviously, most of our expats have got this issue. So you spoke about treatment goals. Well, just explain what you meant by that.
Okay. The interesting that many of expats have to manifest of the symptom
Yes.
of they need to wake up at night
Yes.
to go to pee
Yeah.
or go to toilet.
Yeah.
Even in the daytime,
Yes.
they cannot void easily.
Yeah.
They need to wait in front of the toilet
Yeah.
and wait for the urine came out.
That's it,
Or someone
yes.
praying to where the urine
It's
came
true, though.
out.
It's true. It's true.
Yeah.
I'm not admitting to that, but it's true. Okay?
Yeah, I heard a lot of them from my patients.
Yeah.
The treatment goal is the reduce that symptom.
Okay.
Because of the getting larger when you are getting older.
Yes.
So the symptom cannot be cured,
Okay.
but it can be reduced.
Okay.
And also can be reduced to the normal.
Interesting,
With the observe, just only the observe, or just only the follow up.
Yeah.
So the treatment goal is to decreasing or reducing the symptom
Okay.
that happen from the prostate are enlarged.
Yes. Okay.
And the next thing is to prevention.
Yes.
To prevention that you cannot pee.
Yeah.
The urine will come backward
Yeah.
into your
You
kidney.
mentioned that. Yes.
Yeah. So with this condition can cause the kidney shutdown.
Yeah.
Or the kidney are getting worse. So with treatment of this condition can be reduced or prolong time to hemodialysis,
Okay.
time to be end-stage renal disease.
Yes.
The second goal is to reduce that symptom.
Yeah, interesting. Yeah, interesting. Okay, and then you spoke about this is very interesting. This is relevant to really everybody.
Yeah.
Okay, and it's unusual that we have something a topic that's really of interest to everybody. So, and then you spoke about treatment options. There were 3 treatment options. You started off with the first one, which was lifestyle changes. Would you like to just explain a little bit about that?
Okay, there is not actually option.
Okay.
Everyone should, if you have some kind of symptom, they should have lifestyle modification
Agreed.
first, with or without the surgery, with or without the
Yes.
medication. You need to lifestyle change.
It's true.
First.
It is true.
Yeah. And the second one is the drugs.
That's it. You mentioned drug therapy. Yes.
Yeah, drug therapy is the drug. You just need to take it. No pain, no surgery, no hospitalization.
And are they is that drug or those drugs addictive, or can you come off them at any time?
Yes, in some patients, they just only take the pills.
Yes.
Just only take the pill. Can control the symptom. The kidney is okay. And I already done. My job is already done.
Okay.
But after the drug, cannot reach the goal.
Yeah.
Cannot save the kidney.
Okay.
Cannot resolve the problem.
Yeah.
So the next step
That's
is
it.
to surgical treatment.
Procedures. Is
Yeah,
that right?
the
And you were showing some videos and everything, and
Yeah.
you know, it was very, very interesting. You know, you got a lot of questions on the back. So procedures. What about sort of recovery time on procedures and that?
In the procedure that I talk today,
Yeah.
is the three main procedure. Is the first one is the standard. The
That was
gold
it.
standard is
Yes.
the TURP, called from the transurethral resection of the
Right,
prostate.
okay.
In the easily way or the simply way is the electrical cutting the prostate.
Yeah.
And make the urethra getting
The
larger.
hairs on my arm stood up there when you mentioned cutting. Okay.
Hey, a little bit cutting. You will not feel the feeling cutting.
You sure? Okay.
Yeah.
Okay.
And to make the urethra large.
Okay.
With this procedure, the recovery time is about 3 nights
Okay.
at the hospital after the procedure.
Okay.
3 nights. But the second thing that I talk
Yeah.
today is the laser.
Yes.
The laser is my compatible with the larger prostate.
Right. Okay.
It can less but loss, less bleeding
Yeah.
than TUR,
Yeah.
and also less in hospital stay for
Yes.
1 day. After the laser in average treatment, you can stay in the hospital in average. It's about couple of nights.
Okay. So not too bad. Not too bad.
Yes, but the last thing that
Yeah.
we talk and is more interesting emerging is the hot water.
That was
or the
that was
water
different.
vapor.
I'd never heard of that. That was good, and you got a lot of feedback on that. So explain briefly what that is.
Okay, it's the hot water or the resume or the water vapor therapy. It's the same thing. The simple way is the injection the hot water or the steaming water
Yeah.
into your prostate.
Not boiling water.
Boiling is about 100 degrees,
Okay.
but you cannot feel it.
You sure? Because the hair's standing up again.
Yeah, you will never feel it. You will just only in the
Is that because of
surgical
local
bed.
anaesthetic or general anaesthetic?
by your condition.
Yes.
That your condition compatible with the spinal blockage
Okay.
or the sedation.
Okay,
It's okay. But with your condition or the anxiety or the
Yeah.
something, you can also do the general anesthesia.
Okay.
With the procedure, I didn't mention that the procedure, the proceduring time
Yeah.
of the injection of the hot water
Yes.
is about 30 minutes.
Is it?
Yes, 15 to 30 minutes.
Of hot water going in?
That's all.
Okay.
Hot water will going in with one injection.
Yes.
They do the 9 seconds,
Okay.
only 9 seconds, and we do the about 6 to 10 injection,
Whoa.
and that's all.
And that one got a lot of interest from everywhere because a lot of people are scared of laser. Yeah, they are. But this one seemed a little bit okay.
But if you want to take this lower, you want to take the advantage of the lower risk of surgery,
Yes.
you will remind yourself that cannot take place, only place the laser technique or the
Okay.
electrical
Okay.
technique. And after the procedure, you need to wearing the catheter
Okay.
about 1 to 2 weeks.
Okay.
In my experience, there is 10 days.
Okay.
10 days.
Right, but really.
There is like a coil.
Yeah.
There is a head and tail.
But it was good, mate. You answered all the questions very good. A lot of questions. But listen, we don't have a lot of time. So look, any last minute recommendations to people looking, on this clip and or for our general expats? Any last recommendation?
The recommendation for me for today with the whole concept of the prostatic hyperplasia. If there is, I think is do not or don't think it is a normal. If you're annoying, if you think it's problem,
Yeah.
you come to see and talk.
Yeah.
Yeah. I think it is the first step of the treatment of the prostate.
I think
Do
so.
not let it go. Do not let it wet. You are did not need to
Yeah.
wake up at night. You cannot let the prostate condition
Yeah.
steal your sleepness, steal your
It's true.
happiness.
It's true.
You do not let it normal.
Okay. Okay, so do something about it. Come and see you,
Yeah.
get some advice, and then away we go.
It's okay.
Very good. Listen, I'm going to thank you very much for. Now, usually we have a certificate, and for some reason we don't. So I'm going to give you this for now.
Okay.
Okay, and say thank you very much
Yeah,
for
it's
coming
more
on.
than-
I will give you a proper certificate later on. Is that okay?
If you sign here, it might be the best certificate.
I will,
that
I will
have.
thank you very much. Okay, excellent. So listen, once again, Ron Cardi Expat Club, very, very interesting, relevant topic for everybody. In the meantime, come back and see us next Tuesday, Hotel Barracuda, 9:30 breakfast, camaraderie, information, help, everything you need to be successful and live a happy life. Okay, so at that, thank you very much, and please say goodbye.
Oh, okay. สวัสดีครับ
Oh, very good. Okay,
in
thank you.
Thai, in
Sawadee
Thai.
Cup.
สวัสดี
Okay,
ครับ
thank you.
Okay, thank you. Nice to meet you. Okay, have a good day.